For the best possible results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton. Summer is quickly approaching, so today we have 2 guests here to discuss some ways that you can keep your children healthy throughout the summer and get them ready to go back to school in August. Our first guest is Robert Schoendorf, the Sleep Center Manager for St. Tammany Parish Hospital. Welcome, Robert.
Welcome. Good morning. Thank you.
Can you first tell us a little bit about your background and how you got into sleep?
Absolutely. So I've been in sleep, doing sleep studies, overnight sleep studies for about 10 years. I've been with St. Tammany for just over 8 years, and now took over about a year and a half ago as the manager. So
Awesome.
Making the night to day work shift.
Great. All right. Well, can you, tell us a little bit about how much sleep children should get in general?
It varies depending on the age. Typically, the older the children get, the less amount of sleep is required for them to function. You're really looking at kindergartners to 8th graders, roughly 9 to 10 hours of sleep, and on up from there. So 11th and 12th graders, maybe just 8.5 hours to fully function throughout the day. So.
Yeah, that's funny because I feel like I've always heard in my life teenagers need the most sleep of anyone, but that's not particularly true.
No, not so much. I guess maybe because they might do more, be a little more active, they might think they require it. But really, if you're just the average kid, teenager, the recommended amount about 8.5.
Okay.
So, and I say the average because, of course, there's people that require more, some require less, especially whenever you get adults. They kind of establish a routine, a sleeping pattern. They could be perfectly fine on 5 or 6 hours of sleep.
Okay.
So, yeah.
Can you talk a little bit about how kids might act if they're not getting enough sleep?
Unruly. A lot of times, especially like in school, if you have a teacher that has a kid who's just not paying attention, always constantly acting out, one of the things could be they're just not getting enough sleep. Obviously, could be other things going on, but acting out, hyperactivity, which is kind of odd. You would think, all right, if they're not getting enough sleep, they're going to be sleepy throughout the day, but it's actually kind of the reverse effect.
Okay.
Just kind of their body's fighting back in a sense.
Right, and is there anything that parents might deal with at home in the morning, in the evening, that would kind of indicate they're not getting enough sleep?
Well, if you establish that routine, that set bedtime, set wake time, and you still notice this stuff going on, you know for a fact you've taken out all the electronics out of the room, no TV on, stuff like that, to where you're trying to isolate to where they're getting that sleep, or you're trying to allow them that much sleep time. And they're still acting out and having issues, then you might want to start looking into it. But like I said, I can't stress enough the establishing that routine, get them going to bed at the same time every night, roughly, give or take. I understand you got school activities and sports and all that stuff, but just trying to establish a routine.
And so is that even more important in the summer when they're not in school?
Totally. Weekends, and I know like during the school year, you tend to want to let them sleep in or sleep all day on a weekend. That's actually even worse because then when you come back around to that Monday morning, it's that much more difficult for them to get going. Kind of the same thing with the summer. You still want to keep them on that routine of maybe not quite so early like you have them get up, for school, but still get them up, get them out of the house, get them going because you want to keep that same pattern.
Okay.
So.
Can you tell me a little bit the signs of obstructive sleep apnea in children?
Children are kind of about the same with adults. If you have any snoring, any waking up, gasping for air, and then of course the signs, the daytime signs. If there is any fatigue, the hyperactivity, the acting out, those sort of things.
All right. And what are the risk factors for obstructive sleep apnea?
Over time, it just leads to heart disease and whatnot. You really want to catch it as young as you can. So if you see your child or teenager or even adult, if you see anybody with these signs, you just kind of want to treat it. I like to say it's your body's designed to get the sleep at night. It's the restful time. It's whenever your body is kind of recovering from that day and preparing itself for the next day. So if you have obstructive sleep apnea, you're not breathing properly at night, you're not getting that oxygen level, or you're maintaining that oxygen level. So your heart's working overtime. So when your heart is supposed to be relaxing and just kind of chilling for 8-9 hours at night when you're sleeping, it's now working. So like I said, throughout the course of your life, your heart, that 24/7 working, pumping more and more, it's going to lead to that heart disease.
Okay. So do teens have kind of different problems than children might have when it comes to sleep?
I would say yes, because now you are going to equate driving into it. Whenever that teen gets behind the car, the wheel of the car, then you have a ton of other risk factors. It's not just a sleepy kid anymore. Now you're, I hate to say arming them with a car, but so yeah, you just want to be more vigilant with that. Especially teenagers are going to be going out more, hanging out later, staying up later, and then when you get to the teens, you're introducing more and more electronics and games and stuff like that. So you really, it's difficult, but you want to be more vigilant with the teenagers.
Okay. And what can be done to optimize better sleep?
Really just knowing that it's important, that it's required. A lot of people, adults, I can't tell you how many adults come into our sleep center and they think, I get 4 hours a night, I'm good. Well, maybe their body's kind of adjusted to that, but it's still not good. You have to know that you need sleep. You need to allow your body to recover. I'll keep going back to it, but the devices in the bedroom, laptops, phones, TVs, it's always good. You need to kind of wind down from the day if you're laying in bed, maybe read a book, or you can even, read on the laptop or iPad, whatever. But just know when to kind of set it aside and, all right, let's go to sleep. Don't sleep with the TV on. All those lights trigger chemicals in your brain to wake you up, to keep you up. So caffeine's a big one. Obviously we all need it. I've had my 2 cups this morning.
Right.
But you wanna limit it throughout the afternoon. You don't wanna have a big cup of coffee at 6, 7 in the evening, or even drinking those sodas, because that stays in your system a lot longer than you think it will. Okay. And lastly, just keep a routine. Keep that, try and keep that same pattern. We're creatures of habit, so we just want to stay in a routine.
All right, awesome.
So, yep.
And then I guess for people who think they might have an issue, they do all of these things and still are having trouble sleeping, what do you recommend for that? Come
see us. Come visit us. Right now, we're kind of in the healthcare world. We're dealing a lot with insurance companies. They're really affecting everything we do.
Right.
So we offer home sleep studies. It's a really easy thing. It's a little device. The patient would come to the sleep lab. We'd set them up with it. They take it home that night, sleep with it, and return it the following morning. So it's not, not forcing people to come into the sleep center, spend the night in a different place that they might not be comfortable with, or set aside time from their life. If you've got kids at home or whatnot, it's hard to get away for a night, even for a medical procedure. So we do a lot of home sleep studies nowadays. We've got Dr. Lauren Davis in our sleep center. She's our board certified sleep physician. So you come meet with her, kind of go over any issues you might be having, and she could direct us, or you, in the right direction.
Okay,
so,
well great.
Yeah.
Well, thank you so much for being here and giving us this great information on sleep. Hopefully kids can keep up their routine this summer and get back to school and be ready to go in August.
Yes, ma'am. You can reach us at, our number is 985-871-5987. We're on Highway 21, in between the hospital and the interstate. All that construction going on now. But give us a call, come by. Thank you, Amanda, for having me.
Thank you. I'd like to thank Robert for being here and giving us some great information on sleep. Up next, we'll have Robin Birdsong from the Community Wellness Center to talk a little bit about vaccines and healthy eating.
When it comes to your family's health, you want the best. That's exactly why St. Tammany Parish Hospital and Ochsner are now working together. By uniting 2 of the highest quality healthcare organizations in the state, we can bring everyone in St. Tammany Parish a higher level of specialty care with advanced procedures and the most advanced technology. Because when your health care is better, so's your life.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. Our next guest is Robin Birdsong, a registered nurse and the clinical supervisor of the Community Wellness Center at St. Tammany Parish Hospital. Welcome, Robin.
Good morning.
I guess first tell me a little bit about your background as a nurse.
Well, I've been a nurse more years than I really want to admit in front of anybody. A very, very long time, and my background has primarily been maternal child nursing, and then for the last 15 years I've been involved in public health through the Community Wellness Center.
Okay, and I guess tell me a little bit about what the Community Wellness Center does.
The Community Wellness Center has some programs similar to what you might see in a public health unit. We are part of St. Tammany Hospital, so we contract for the programs. Our main program is the WIC program, which is Women, Infant, and Children's Nutrition Program. It's a supplemental food benefit program, but along with that we do referrals to other needed organizations. We do a lot of health education in the program and a lot of counseling about good nutrition.
Okay. So I guess on that note, can you talk a little bit about healthy eating and kind of encouraging parents and children this summer to stay healthy while they're out of school?
Yes, moms have a different ball game this summer because children are going to be home. They may be going to camps, they'll be packing lunches, and they want to focus on healthy. One thing we're promoting, it's a national initiative and it's also a Louisiana state initiative, is the 5210 program. And that incorporates healthy eating, but it also incorporates other health factors. And the goal of the program, 5210, it's very simple and easy to remember, but it's to get 5 or more servings of fruit and vegetables a day, to have 2 hours or less of screen time, and that includes TV, smartphone, video, computer. They recommend no TV for children under 2 years of age. 1 hour more physical activity a day. And this doesn't have to be organized sports or a gym. It can be walking. Walking is ideal for families. Mom can put the baby in the stroller. You don't have to think about what you're doing. You're just walking and enjoying it. And then the other thing is to have 0 soda and sweetened drinks and more water. And low-fat milk for ages 2 and older. And for the 1-year-olds, they would have the whole milk. And we're promoting spa water, infused water. That's where you can cut fruit and just slice it, put it into water, let it steep, and just pour the water. You're not squeezing the fruit. You want to avoid getting the acids that may be in the fruit. That can impact your teeth. Talk to your dentist about that. But just let the fruit sit in the water, and it imparts a very slight flavor to the water. It's very refreshing, and it might be very appealing to children. Visually, it's very appealing.
Okay.
So check with your dentist to make sure it's okay with them to use that as an alternative to juice,
Right.
which juice is a healthy food, but it has a lot of sugar, so you want to give juice in very small quantities. And children should get about 4 ounces of juice a day, adults no more than 6 ounces of juice a day.
Okay.
So that's just a good thing to keep in mind when you're packing lunches and offering drinks. I encourage parents to read labels because a lot of things that are marketed look healthy. They look like they may be a good thing, but check the label for the sugar.
Okay.
You want to make sure that you don't have sugar grams in the drinks that you're giving to your children. The constant sugar on the teeth can form bacteria that can cause cavities. So the ideal thing for them to be drinking a lot is the water.
Okay. And
Just the plain water.
is there any sort of age recommendation, you know, they shouldn't have sugar before they're a certain age, like sugary drinks at all before, you know, they're a certain age, or in general?
Ideally,
just
they
never?
would not. Ideally, it would be never.
Okay.
But that's not realistic. And you know what I might tell parents is maybe on occasion as a treat, so they look at it that way and not as a daily thing.
Okay.
I think they're coming out with a recommendation that children under 1 not have juice.
Okay.
So really, they would have the breast milk ideally, and then if moms are not breastfeeding, then the formula. Really, infants do not need added water because they're getting all the liquid they need in the breast milk or in the formula.
Okay. And on the note of healthy eating, can you talk a little bit about the community gardens that y'all are working on and how maybe families can get involved in that in the summer?
Yes, we're very excited. We have a master gardener who has volunteered his services, and we have a small but very lush garden growing in the back of our building. And we have squash, we have all different kinds of herbs, cucumber, rosemary, thyme, oregano. Families can come and see it. And I think when children see fruits and vegetables growing in a garden, it can get them excited about food. One of the most challenging things for parents of young children is to get them to eat a variety of fruits and vegetables. And I think if they see these things growing, it can make them more excited about it. They actually are supposed to be able to use their vouchers. They get a cash value voucher for fresh fruits and vegetables, and they're supposed to be able to use that to get seeds to actually grow.
Okay. Is that through the WIC program?
That's through the WIC program. So they can come and visit the garden. When the master gardener happens to be there, he is so willing to give you advice. And we've had people who said they can't grow anything get very excited after talking to Tim. So anybody can do it. You can do it if you don't have a big yard, you can do it in pots. We've used children's swimming pools, small plastic swimming pools as a base to plant the vegetables and the herbs, and that's worked very well. So that could be an exciting summer project for the kids to see. And there's nothing like a fresh tomato. Oh my goodness, it tastes so much better than anything you get in the store.
So that's a kind of an outdoor activity that families could do together.
It is, and I encourage moms when they shop, or families when you shop with your children, to pick up the fruit and vegetables and talk about the shape, talk about the color of the foods, talk about the smell of the foods. And I think when you get the children involved that way, they might get more excited about it. Look for things that children can help in the kitchen. Look for age-appropriate activities they can do in the kitchen. When they're involved, when you get them involved in the process, I think they get more excited about the food. And the exciting thing about summer is there's an abundance of fresh fruit and vegetables. We're blessed to be in this state that has so much fresh fruit and vegetables.
Okay. I guess on to something else that y'all do at the Community Wellness Center, immunizations. It's something that I think families don't usually think about till, oh, school's coming up, I have to get that, but it's better for them to, start thinking about it a little early. Can you talk about the importance of immunizations?
Yes, it's much better. Well, first of all, it's a requirement for schools that the children be immunized. It also prevents against a lot of diseases. We are seeing a resurgence of some of these diseases. In the States, we have individuals coming from other countries that don't have the same immunization program that we have. So they have quite a few cases of measles in different areas of the country. We also want to protect our babies who are not immunized yet against some diseases. Whooping cough has seen a resurgence, and so we're really trying to get adults immunized with the Tdap, which is the tetanus, diphtheria, and pertussis. Pertussis is the whooping cough. But when adults are protected and other children are protected, we protect those babies against immunizations. But yes, it is a requirement for schools, so you have the kindergartners, the pre-K, going back to school in the fall, and you have the teens going back to school in the fall. These are all children who are going to need vaccines. The college-bound students, a lot of colleges are requiring vaccines. So make sure you get your records in, have them checked to see if they need anything. We can offer vaccines to anyone through the Vaccines for Children program. If you have Medicaid, if you have no insurance, or if your insurance will not cover vaccines, then we can offer vaccines through the program. If you have Medicaid, we bill Medicaid for that administration in the vaccine. And then if you don't have Medicaid, then it's a $21 charge per injection. We do have private pay vaccine. We have a select menu of vaccines on private pay. Call and we can see if we can get that for you. And then it would be a cash pay, or if your insurance covers it, then we can bill the insurance. We also encourage adults to get immunized. The tetanus, we talked about the Tdap, that would be adults. And then in the fall, we're not there yet, but think about getting the flu shot for the whole family. Everybody who's age appropriate should get covered, and that's 6 months and older should get the flu shot.
Awesome. Well, one other thing that we want to talk about, especially with summer coming up, a lot of people are going to be outside at the ballpark, and Zika has been a big issue in the media lately. So can you talk a little bit about that and protecting your family?
Yes, Zika virus primarily I think has been seen in Central America, South America. They have had mosquitoes carrying Zika in Florida. We're encouraging our families to be in the habit of protecting everybody against mosquitoes. The reason this is of great concern is that pregnant women who are infected with Zika virus, it can impact the fetus. And it can cause a problem called microcephaly, and that's where a baby's born with a very small head. There can be developmental issues. They can have defects of the eye. There can be hearing deficits. It can be very devastating when you're expecting this beautiful, healthy baby, and that's not the outcome. So what can families do? We want you to be in the habit of using insect repellent, mosquito repellent. Check with your pediatrician for children. We don't recommend repellent for infants under 2 months of age. And then there's a product that we recommend you avoid for children under 3, and that would be the lemon eucalyptus, oil of lemon eucalyptus, and paramethane diol. So check with your pediatrician for those little ones to make sure they're safe. Also, you can use a barrier of long sleeves and long pants when you're going to be outside. The mosquitoes do bite in the daytime, but they can also bite at night. You can use mosquito netting. Staying in air conditioning helps, so we're fortunate. I think most of us in Louisiana have air conditioning, but other areas may not. And then it's also sexually transmitted. So if you have a partner that travels, and if you're pregnant or you're thinking about getting pregnant, if that could be a potential issue, you want to use condoms or just abstain.
Okay.
That would be a protection.
All right, and then can Zika affect people other than pregnant women? Are there symptoms of it?
Yes, it can. It can. And the symptoms, typically, some people may not have any symptoms, but it can cause fever, it can cause rash, joint pain, a red eye. You can have other more complications like muscle pain and headache. It can last from several days to a week. One thing they recommend is that you not take acetaminophen or aspirin or non-steroidal anti-inflammatory drugs.
Mm-hmm.
So you can take acetaminophen, which is Tylenol.
Okay.
That is acceptable, but they don't recommend the others. Get plenty of rest, drink plenty of fluids. If you're taking medicine for another medical condition, talk to your provider before taking additional medication.
Okay, great.
So, and they say that if you do get the infection, that you may be protected from getting it again. So that's a good thing about getting it, but you just really don't want to get it if you're pregnant.
Right.
For sure.
Okay, great. Well, thank you so much. I think that's a lot of great information for families this summer. I'd like to thank Robert and Robin for being here today and giving us some great information for children and families to protect them throughout the summer and keep them healthy. This has been Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton, and we'll see you next time.